This is Duke University.
For years, Maria Bruno was one of an estimated 45 million Americans suffering chronic headaches triggered by sinus problems. Maria's pain was so intense that her work and home life, including time with her son, took a back seat.
There were times when I was so sick on the weekends that even during one of his baseball tournaments, I'd be at the baseball tournament and I'd be sitting there with my head, on a picnic table, just trying to, get through it so I could watch him play. So it's debilitating.
Maria sometimes took several medications at the same time, but the pain continued. When a neighbor recommended acupuncture as a potential therapy for the pain, Maria scheduled an appointment.
My neurologist was trying a lot of different things to help, and then once I tried the acupuncture, she was really supportive and thought that was great. She says it does help a lot of people. It doesn't work for everybody, but it definitely worked for me. So I'm on a very small dosage of a preventative medicine I take every night, and then the combination with that and the acupuncture, it's made a big difference.
A new Duke study seems to confirm Maria's positive experience with the age-old therapy. Duke researchers found that acupuncture is more effective than medication in reducing the severity and frequency of chronic headaches after reviewing the results of 31 studies. Of the studies comparing acupuncture to medication, the researchers found that 62% of the acupuncture patients reported headache relief compared to only 45% of people taking medication. Correct technique is important as well. Sham acupuncture, which was done on parts of the body not associated with the ancient Chinese principles, was less effective than traditional acupuncture.
Acupuncture, the fact that there is very little downside, there's very little side effects, if any, and so certainly I would advise a patient with headache, if the conventional therapy doesn't seem to work, it would be worth trying acupuncture, and typically after 5 or 6 sessions, you should know whether acupuncture would help your headache or not.
Acupuncture therapy is becoming widely available nationwide and is virtually pain-free. A typical course of treatment for chronic headache requires several 30-minute sessions. At the Duke University Medical Center, I'm Mike Garrison.
Produced by Duke University. Online at duke.edu.